The tibialis anterior runs along the lateral aspect of the tibia. It's thick and fleshy above, and as you go lower, it becomes more tendinous below. It acts to dorsiflex the foot as well as invert. A common injury here could be shin splints, and I oftentimes find that at the more thick and fleshy portion in the upper portion of the muscle, you're going to find a common acupressure, tender, or trigger point. That's worth exploring, and it could relate to pain into the knee and also down into the ankle. Moving into the ankle, we're going to look at the tibialis anterior, which you will find just off the shin bone, and then you can move your fingertips laterally and go along this area and search for any tender points or trigger points. And once you've found one, what you can do is you can bring the foot into dorsiflexion, and then you can bring it into inversion. And then you can also provide a little bit of compression down on the ankle as well. And that just helps to relax and ease off that tissue. And once again, you could also do some eversion, inversion, and you're looking to just find that direction of ease where that tissue feels like it's melting underneath your fingertips and there's complete slack in the tissue. The tibialis posterior muscle can be palpated in the deep posterior compartment of the lower leg. Also, its tendon and lower fibers can be found just behind the medial malleoli and just into the foot. One thing that I'm going to mention to you guys to consider here is that the tibialis posterior tendinitis could actually be what people perceive as plantar fasciitis. That's something to keep in mind. And also, don't discount the role of this tendon and muscle in shin splints. We're going to look at the tibialis posterior tendon and muscle. So what you're going to do is find the medial malleolus, and then you're going to go down just underneath that, and you're going to find the tendon and the muscle. And once you've found a tender point, which I can feel right about here on Kate, what you can do is you can place your other hand, wrap it around the foot, do plantar flexion, and then a bit of inversion, and that helps to take the slack off of this area and allow you to relax it with your fingertips. You can also evert, and then once again invert just to make sure that the tissue is slackening, and you can plantar flex even more to allow the tissue to relax. The Achilles tendon is formed by the soleus and gastrocnemius musculature. This is oftentimes a site of irritation for people, especially athletes. It's estimated that about 60 to 75% of Achilles ruptures are due to sport, whether that be soccer, basketball. Anecdotally, I've actually seen in my neighborhood, I go to the climbing gym quite a lot, and people who jump down, they get Achilles ruptures quite often. This is something that you want to bear in mind if you're working with someone who does any type of athletics, whether that be a very extreme athlete or someone who's just a common runner. Check this area, make sure that everything in the area isn't too tense and extreme, and make sure to release the tender or trigger points around the tendon. Have the knee flexed to 20 to 30 degrees. Use your knee as a bolster, and then you can bring the foot into plantar flexion with your knee. And then you can place your fingertips either on either side of the Achilles, trying to find the tender point, or you can place it over the Achilles to do a release directly on the tendon. Now, as you move that into plantar flexion, what you can do with this hand is take the heel of your hand and compress that area even more. And this helps to relax the Achilles tendon. This is really nice for anyone with plantar fasciitis. And then once again, hold it, follow the protocol, and wait for the tendon to relax underneath your fingertips, which may take 60 to 90 seconds. The soleus lies deep to the gastrocnemius. The muscle is thick and broad, but it only covers one joint, the ankle joint. One thing to consider here is that there could be a soleus strain, which happens when the cap is stretched, and as it's being stretched, it also contracts. This is something that you can communicate with the client and see, hey, is this something that's happening to you quite often? And as you're going in and palpating between the gastrocnemius heads, with this technique, you can go a little bit deeper to find the tender or trigger point. And basically for this one, there's going to be the two gastrocnemius heads here. So what you're going to do with one finger is go deep in between the two gastroc heads. And then once you find that tender point, and with Kate, I can feel that it's just right about here. You can then, with your shoulder, place the ankle into plantar flexion. And you can even place the toes into more plantar flexion as well with your shoulder. And then you can even, once again, provide a bit of a downward force on the calcaneus, gently. And then also slowly bring the leg down to sink into the soleus, which is quite deep. The gastrocnemius is a very powerful muscle. It has two heads and it also crosses two joints, the ankle and the foot. So it stands to reason that if there is a tender or trigger point in this area, it can relate to pain that goes and crosses into the knee, behind the knee. It could go into the ankle, the foot, or even extend into the quads. This is definitely one that you want to explore, especially with all the relations that it has in the body and just how powerful this muscle is. Place your knee underneath their ankle, and then they're at about 20 to 30 degrees of flexion. And then what you can do here is, once again, plantar flex, and you can go on either side of the gastroc heads. Although I find a lot of times you're going to find a response or a trigger point on the medial side. So what you can do with that is place your fingertips around like this, plantar flex the foot, and you can even do a little bit of rotation at the ankle just to soften the tissue. And right there I can feel that that is the direction of ease for Kate, and the tissue is softening underneath my fingertips. The peroneals lie on the lateral outer aspect of the leg. One thing that happens here is that this muscle can become strained due to any type of inversion ankle sprain. So look down the line and see if there are any trigger or tender points that you can find. Now we're going to do the peroneals, which are on the lateral side of the leg. And once again, search along this line, find the tender point, and I can find with Kate that it's right here. And then what you can do is place your arm on the entirety of the foot, and then you can do a little bit of compression once again on the foot and ankle. And then you want to do a really nice job of everting the foot here. And once you've done the eversion, you should feel it softening underneath your fingertip.